Yes, sir. You are live now, sir. All fine now.
ठीक. Hello everyone. Am I audible? हाय, सुनाई दे रहा है आप लोगों को? Hi, good afternoon. ठीक है. Right, so this is the session before the main exam. We are discussing some potential questions which can be asked in the exam. Right, we have done 2 detailed sessions. One of them was available on YouTube as well. So please go through that session also, because that would give you a lot of information which is required. Okay, so this is just some potential questions which I feel might be asked in the exam. So Oshner-Sharon regime, when is it aborted, and emergency surgery is done in case of an appendicular mass. So you know that Oshner-Sharon regime, क्या आंसर है? पहले आंसर बताओ. Okay, so correct answer is A here. Correct answer is A. You know, Oshner-Sharon regime is a conservative regime, right? It is conservative management. It is conservative management of a patient who's formed an appendicular mass. अपेंडिकुलर मास का क्या मतलब है कि जब अपेंडिसाइटिस होती है, इन्फ्लेमेशन हुई, तो वहां पे ओमेंटम आके भी चिपक गया, बावल आके भी चिपक गई, एंड इट फॉर्म्स इनटू अ मास. जब मास बन जाता है, इफ यू डू सर्जरी एट दैट टाइम, यू कैन इंजर द बावल. आप बावल को इंजरी कर सकते हो. तो जब अपेंडिकुलर मास बन जाता है, वी डोंट डू सर्जरी एट दैट टाइम. ठीक है, वी डोंट डू सर्जरी एट दैट टाइम, वी वेट, राइट? वी डू कंजर्वेटिव मैनेजमेंट. नाउ कंजर्वेटिव मैनेजमेंट में, इफ द साइज ऑफ द लंप रिड्यूसेस, पेन रिड्यूसेस, टेम्परेचर रिड्यूसेस, right, then the patient is healing. We are going to discharge this patient, and we will call this patient after 6 weeks for an interval surgery. But if the size is increasing, pain is increasing, means tenderness is increasing, fever is increasing, that means the patient is forming an abscess. And if the patient is forming an abscess, we need to abort the conservative regime and we need to carry out surgery. Is that clear, everyone? Okay, next question. Next question, this is the next question. I want you people to tell me the answer. Correct. This is a Marjolin's ulcer. Correct. You people are right. This is a Marjolin's ulcer. Marjolin ulcer, you know, is a squamous cell carcinoma which develops in long-standing venous scar or burn scar. So long-standing venous scar or burn scar, you are going to get a squamous cell carcinoma that is known as Marjolin's ulcer. And the treatment for this Marjolin's ulcer is surgery. We should not do radiotherapy. Radiotherapy is not effective in these patients, so we need to carry out a good surgery for these patients. Aphthous ulcers can be seen in the oral cavity, and these aphthous ulcers can be associated with inflammatory bowel disease as well. They can be associated with inflammatory bowel disease as well. Pressure sore or bed sore I've covered in the previous YouTube session which I took. It is a very important topic. Lots of questions are asked from pressure sores or bed sores. You cannot ignore it, right? So please pressure sore, bed sore के बारे में अच्छे से पढ़ के जाना. Necrotizing fasciitis. Can you tell me what is necrotizing fasciitis involving the scrotal region known as? Necrotizing fasciitis involving the scrotal region, what is it known as, everyone? What is necrotizing fasciitis involving the scrotal region known as? No one? So this is known as Fournier's gangrene. It is known as Fournier's gangrene. Fournier's gangrene is necrotizing fasciitis involving the scrotal region, and this is synergistic gangrene. Synergistic gangrene means that aerobic plus anaerobic bacteria are there. Why are you scared? You people have studied so much. That is why you've got selected for mains. अब थोड़ी ना डरने की ज़रूरत है. तुमने इतनी मेहनत कर ली, सब कुछ जानते हो. अभी तो बस इम्पोर्टेंट चीज़ें एक बार जल्दी से रिवाइज करनी है. अपने पे भरोसा करना है. You're going to do very well. Right. So involving the scrotal region, this is Fournier's gangrene, and we need to do surgery for these patients. Okay. Next question. Yes, answer. So you have a 45-year-old male who's rescued from a burning building, brought to the emergency ward, severe burns all over the body, including the entire circumference of the abdomen. Despite initial resuscitation, patient still has decreased urine output and hypotension. What is the most appropriate treatment for this patient? So we have to do eschorotomy. That is correct. Eschorotomy is correct because there is circumferential, but eschorotomy पेट के अंदर क्या एस्चेरोटमी होगी? दिस पेशेंट इज डेवलपिंग abdominal compartment syndrome. This patient is developing abdominal compartment syndrome, and abdominal compartment syndrome के अंदर we need to do a decompressive laparotomy. So eschorotomy अगर chest के around है, अगर हाथ के around है, then we do eschorotomy. We cut the eschar. You people are correct. But for abdomen, to release the pressure, we need to do a laparotomy. We need to open up the abdomen, and that is what will release the pressure of abdominal compartment syndrome. ठीक है. Compartment syndrome में we do fasciotomy or eschorotomy, and we have discussed in the previous YouTube lecture that eschorotomy or fasciotomy, we have to cut till the deep fascia. We have to cut till the deep fascia. Okay. Next question. Extramammary Paget's disease is commonly seen in. Correct. Vulva is the correct answer. So Paget's disease is usually seen in the breast, where it is an itchy lesion which replaces the nipple areola complex. Replaces the nipple areola complex, but it can be seen in the vulva as well. Extra mammary pages is seen in the vulva. Correct, you people are correct. Next question, which is the most common feeding regime related complication in total parenteral nutrition? Yes, next question. That B is the correct answer. Hyperglycemia. Hyperglycemia is the most common feeding regime related complication for total parenteral nutrition, which is why we carefully monitor the blood sugar level. Okay, which is why we carefully monitor the blood sugar level for all patients who are on total parenteral nutrition. एक और चीज मुझे बताओ, overfeeding. Overfeeding, what is the earliest sign of overfeeding on TPN? This also you should know. Earliest sign of overfeeding when TPN is being done. As a nurse जो ICU में posted है, जिनको TPN चल रहा है, how do you know the earliest sign of overfeeding? So earliest sign of overfeeding is excessive weight gain. Excessive weight gain. Correct. Very good. Preetha, Ayan, Prince Kumar, very good. Excellent. Excessive weight gain. बहुत बढ़िया. No, not refeeding symptoms, Prince and Suman. Excessive weight gain. Very good. Excellent, guys. Refeeding I've discussed in the previous YouTube session. Okay, answer this question now. Answer this question. So B is the correct answer. We know that this is surgeon's knot. This one is surgeon's knot because इसमें दो throws हैं. We've discussed this. I've discussed this in detail. Two throws makes this surgeon's knot. Now square knot and granny's knot also I've told you the difference. यहाँ पे you see one is going above, one is going below. Alternate वाला जो होता है that is square knot. एंड जिसमें दोनों ऊपर या दोनों नीचे से जा रहे हैं दैट इज ग्रैनीज नॉट. दैट इज ग्रैनीज नॉट. So you should know about your knots and sutures. Next question. A young boy presents with slowly painless swelling over the right eyebrow. Yes, what is the correct answer here? So this is a dermoid cyst. Dermoid cyst is formed at the lines of embryonic fusion. So such a cyst would be formed at the outer canthus of the eye, lateral canthus of the eye, or post auricular dermoid. Outer canthus of the eye or post auricular dermoid, कान के पीछे. So this cystic swelling is known as a dermoid cyst, and you need to excise this swelling. You people are not answering only. इतने घबराए हुए हो क्या तुम लोग? This is the next question. 25-year-old presented to the emergency. He has flat white patches in the oral cavity. A biopsy is done and cancer is diagnosed. Which of the following is the biggest risk factor? You people are not answering only. Okay, yes. C, correct. Human papilloma virus. That is the correct answer. HPV can increase the risk of oral cancer. Which other cancer can HPV cause? Yes, this is called leukoplakia. This is called leukoplakia, which is a whitish patch. HPV और कौन सा कैंसर कर सकता है? Which other cancer can HPV cause? Cervical cancer. Cervical cancer is the correct answer. And correct. Very good. What triad is characterized by abdominal pain, fever, and jaundice? Abdominal pain, fever, jaundice. Charcot's triad, correct. Charcot's triad is correct. Virchow's triad. What is Virchow's triad? Stasis, hypercoag state, and endothelial injury. And what is Reynolds pentad? देखो Charcot's triad and Reynolds pentad both are seen in cholangitis. जब गॉल जो biliary ट्री है उसकी इन्फ्लेमेशन होती है, दैट इज कॉल्ड cholangitis. Cholangitis. So Reynolds pentad is Charcot's triad plus altered mental status. And shock. Virchow's triad is seen in DVT. That is correct. Virchow's triad is seen in DVT. That is correct. This we've discussed many times. Blades, sutures, all these are very important for the exam. Okay, next question. Number 11, blade. Correct, it is used for arteriotomy, it is used for incision and drainage. For arteriotomy and incision and drainage, stab incision, that is correct. B is the correct answer. So Saint's triad is hiatal hernia, diverticular disease and gallstones. Right, Saint's triad जो होता है ना, gall bladder stone, hiatal hernia and diverticulosis को सेंट्स ट्रायड कहते हैं. हेमलता. Gallbladder stone, hiatal hernia and diverticulosis. Next question. Correct, this is कंजेनाइटल हाइपरट्रोफिक पाइलोरिक स्टेनोसिस. सो पेशेंट की हिस्ट्री से भी वो पता चल रहा है, प्लस ये बेरियम के अंदर यू हैव दिस नैरोइंग हियर बियॉन्ड द स्टमक. डिओडिनल अट्रीजिया, व्हाट साइन डू यू सी ऑन एक्सरे? डिओडिनल अट्रीजिया, व्हाट साइन डू यू सी ऑन एक्सरे? Can you see the image now? Correct, double bubble sign is correct. Okay. Next question. This has been asked many times in the exam. I've discussed this previously also in the YouTube session. What is the sign known as? What is the sign known as? Long thoracic nerve is correct. What is the sign known as? Sagupta, yes. Triple bubble is jejunal atresia. This is winging of scapula, correct. Winging of scapula is correct. And what is the most commonly injured nerve during mastectomy? अगर यही चार ऑप्शंस आपको मिले, मोस्ट कॉमनली इंजर्ड नर्व पूछी जाए, मोस्ट कॉमनली इंजर्ड नर्व ड्यूरिंग मैस्टेक्टमी कौन सी होगी? मोस्ट कॉमनली इंजर्ड नर्व होगी इंटरकॉस्टोब्रेकियल. मोस्ट कॉमनली इंजर्ड इज इंटरकॉस्टोब्रेकियल, विच गिव्स राइज टू ऑल्टर्ड सेंसेशन इन द अंडर आर्म. ऑल्टर्ड सेंसेशन इन द अंडर आर्म. Right, next question. बेटा दे आर सेइंग पेशेंट इज कमिंग विद हिमेटेमेसिस. हिमेटेमेसिस मतलब ब्लीडिंग. हिमेटेमेसिस है तो करेक्ट आंसर होगा मैलरी वीस्टियर. बोरहाव सिंड्रोम इज परफोरेशन. बोरहाव सिंड्रोम इज परफोरेशन. If there is bleeding, there is going to be, that is known as Mallory Weis-Tear. Alcoholic patient ही अगर esophageal perforation के साथ आएगा, chest pain के साथ आता है, subcutaneous emphysema होता है, then it is perforation, that is known as Boerhaave syndrome. पहले तो डायग्नोसिस क्या है? So this is pneumothorax. Pneumothorax में नागराज trachea will be deviated to the other side, not to the same side. This is wrong. And when there is tension pneumothorax, you have to put in a intercostal drainage in the second intercostal space. ये चेंज हो गया, you know now this has become fifth intercostal space. पर ये पुराना क्वेश्चन है जिसमें सेकंड इंटरकॉस्टल स्पेस है. यू नो नाउ इट इज बिकम द सेकंड इंटरकॉस्टल स्पेस. हाउ इज इट कार्डियक tamponade? कार्डियक tamponade में you get Beck's triad. You will also get muffled heart sounds. यहाँ पे muffled heart sounds लिखा ही नहीं है. No muffled heart sounds is written. No prince. It is fifth intercostal space now, not fourth intercostal space. Fifth intercostal space in adults. करेक्ट. दिस इज वेट गैंग्रीन. ये सिंपल है, वेट गैंग्रीन है. ये टिश्यू वेट है, वेट गैंग्रीन. दैट इज द करेक्ट आंसर. So we know ringer lactate is the correct. RL is the best solution to resuscitate burns patient. And RL ka composition also you people should remember. Please definitely go through the composition of ringer lactate. That is also been asked in the exam. हाइड्रोकॉर्टिसोन से हाइपरग्लाइसीमिया होगा बेटा, हाइपर हाइपर correct. So this is going to give rise to malabsorption. This is biliopancreatic division or duodenal switch surgery. इसके अंदर maximum weight loss होता है, right? And there is a lot of malabsorption as well, which is why there is going to be malodorous bowel movements, and it improves diabetes mellitus, it improves hypertension also. सो बैरियाट्रिक सर्जरी सिर्फ वेट लॉस नहीं करेगी, बैरियाट्रिक सर्जरी डायबिटीज को भी ठीक करती है, हाइपरटेंशन को भी इंप्रूव करती है. So these were some questions which I wanted to discuss. देखो, I know at this point of time we all feel nervous before the exam, but trust me, you people have done things correctly. That is why you've reached so far. So have faith in your abilities. जो भी किया है उसको थोड़ा जल्दी से रिवाइज कर लो, बस एक विजुअल मेमोरी बना लो, आता आप सब लोगों को है. अगेन एक सिंपल सी एडवाइस दूंगा, क्वेश्चन पढ़ के एग्जाम में आंसर मार्क करना. Right, read the question properly. There are no marks for answering quickly. There are marks for answering correctly. Okay. All the very best for your exam. I am sure इस साल भी we will have a lot of NORCET selections. Okay. All the very best.